A dream doesn't become reality through magic. It requires sweat, passion, determination, and lots of hard work. My name is Leo. I was born and raised in Argentina. I have been living in the US for a number of years now, and I'm a doctor by training and physician. And I am specializing in public health now. I'm a Harvard graduate. I came here to the Harvard School of Public Health to get my master's of public health. I did two different concentrations. On the one hand, healthcare policy and management, and leadership on the other hand. Public health is really important. As a matter of fact, I believe that it should be the most important branch of medicine, and all of us people trained in medicine as clinicians, we need to start developing this better understanding of population's health and diverging a little bit from the idea of individuals being a bunch of symptoms or a collection of pathologies, entities, and starting to gain a deeper understanding of the holistic approach of medicine, because that, at the end of the day, will give us the possibility of understanding that population's health is really important, and if we tackle problems through public health, we're going to be able to have healthier populations. Working in public health has the potential of changing the lives of millions. Just imagine for a second the impact that you have when you are healing a single person, when you're fixing condition on an individual. So now multiply that by hundreds, thousands, even millions. So that's the impact of public health. Well, I think that the main challenge that developing countries are facing and will keep increasingly facing in the future is what we call in public health and medicine as the epidemiologic transition. So this means, in simple terms, that they are not only facing the chronic and historic stigma of infectious diseases, but nowadays they're also facing chronic conditions. Furthermore, the WHO is talking about a triple burden of disease, where they are incorporating a lot of other different conditions that are not necessarily related to the human being per se, but all the different external factors that the environment generate. I think it's time for us, the people working in the healthcare arena, to start asking ourselves the question of what kind of healthcare system do we want to leave to our children? Because if we keep investing a lot of money and putting all our efforts towards a curative healthcare system, we're going to fail. We need to start really thinking on switching towards a preventive healthcare system. If we based all our efforts and we really can envision all the great potential of health promotion and disease prevention, then we're going to be able to have a not only more sustainable healthcare system, but we're going to be able to achieve a triple aim, which is improving the experience of care, decreasing the per capita cost, and also improving healthcare outcomes. My main area of interest within the public health world is health policy and public policy. In fact, I've trained at Harvard doing the MPH program with a concentration of healthcare policy and management in the policy track, in the policy focus. At the same time, I've done the leadership concentration, and that was a great asset in order to understand better why do we need to be great leaders and great advocates when it comes to public health. My ultimate goal is to be able to help vulnerable populations to have a better experience within the healthcare system. And by doing that, I think that we are going to be able to not only change a lot of the reality of the society, but to give people the opportunity of a better future and more equality of opportunities as well. When we talk about giving equal opportunities to people, it's fundamental to understand that it's going to be unbelievably hard to try to give these people more opportunities if we don't use our resources in the right manner. we have research, we have a lot of evidence, we have epidemiologists, biostatisticians, we have a lot of people working in order to try to put all the pieces of the puzzle together. But if we don't try to make health policies that will actually impact for a good change the life of these populations, we're never ever going to be able to have a fair, just, and all-embracing healthcare system. My goal is to be able to make a contribution here in the United States in order to keep improving the health of the populations with this great emphasis on the most vulnerable individuals of the society, but at the same time being able to make a contribution and generate an impact on developing countries as well. In my opinion, education is unbelievably important in order to transfer knowledge. And this is a way not only to being able to update all the time our knowledge, but also to train the future generations of public health workers. In 10 years from now, I don't know exactly what position I'm going to be occupying, but I can tell you for sure that I want to be in a place where I can make a profound impact on different people, and that can happen in an NGO, in the government, or in the private sector. But regardless of the place, I can tell you right now that I will be making a difference and trying to make this world a better place for everybody.